Think about that nagging ache in your lower back. Chances are, you or someone you know has dealt with it.
Oh,
In
absolutely.
fact, low back pain is just this massive global issue, isn't it? A leading reason why people can't do what they need or want to do.
Yeah, and it keeps a lot of folks out of work, too. The sheer cost, both personally and for society, it's enormous.
Oh, okay, let's unpack this then, because today we're taking a deep dive into a really interesting approach for managing that recurring, persistent low back pain, chiropractic maintenance care.
Right, and what's fascinating here is when someone finally gets relief from that debilitating back pain through initial treatment, the big question becomes, okay, what's the best way to keep it from coming back?
Exactly.
Chiropractic maintenance care, or MC as we might call it, is all about those regular sort of preventive checkups even when you're feeling pretty good.
So proactive rather than reactive.
Precisely. These visits can involve hands-on techniques, exercises, advice on lifestyle things, basically trying to minimize future problems.
Yeah.
It's like a proactive strategy to keep things stable.
It makes sense. But here's where it gets really interesting, right? Because the usual approach for many people is often just to wait. Wait until the pain flares up again before seeking help.
That seems intuitive to many.
Yeah. But within the chiropractic world itself, there's actually a real debate about whether these regular check-ins, this maintenance care, is actually more effective in the long run than simply waiting for the pain signal.
It really raises a key question for you, the listener. If you've already had a good response to chiropractic treatment, is it better to have those scheduled follow-ups or just, deal with it when and if it comes back?
And to explore that, we're focusing today on a study that directly compared these two paths.
Exactly. And it's important to note up front, this research looked specifically at people who felt, and this was the definition, definitely improved after their initial chiropractic care.
So the ones who responded well early on.
Yes, the fast responders.
So we're looking at what happens after that initial success story. This study, you said, was pretty rigorous.
Yeah, it was a pragmatic, randomized controlled trial. Pragmatic means it was designed to reflect, real-world clinical practice as much as possible.
Okay.
Took place in Sweden, ran over a year, and had those two groups we mentioned. One getting maintenance care, so regular clinician-led preventative visits.
Right, the checkups.
And the other following the symptom-guided route, only seeking treatment when the pain actually came back. Patient-controlled, basically.
Got it. And how did they measure which approach was better?
The key thing, the primary outcome, was the total number of days per week that people experienced what they called bothersome LBP, low back pain.
There's some LBP. Oh, yeah.
And they track this every single week using SMS text messages. What's crucial about bothersome here is that it wasn't just like a little twinge. It was specifically defined as pain that actually interfered with daily life, your routine, your activities. So we're talking about a meaningful impact.
Right. That makes a difference. And that's what you, our listener, need the real insights, clearly explained. So let's dive into the nuts and bolts of this study. What did it actually find?
Okay, sounds good. Let's start with who was involved and where this all happened. So the study recruited folks from 40 different chiropractic clinics across Sweden.
40 clinics, okay.
Yeah, between 2012 and 2016. And what's quite interesting is that they specifically included chiropractors who sometimes recommend maintenance care.
Why was that important?
Well, it was a smart move, really. It helps avoid skewing the results by only having practitioners who are, say, huge fans or totally against the idea. Kind of balances it out.
Makes sense. Get a more representative group.
Exactly. And the chiropractors also got training to make sure everyone was following the study plan, the protocol, consistently.
Right, keeping everyone on the same page. So who were the actual participants? What were the criteria?
They had pretty specific rules for who could join. Participants had to be between 18 and 65, have had low back pain for more than 30 days in the past year.
So not brand new pain.
No. And they had to have experienced episodes before. Plus, you needed a mobile phone for those weekly updates.
Okay.
And they also had to rule out certain things: pregnancy, recent chiropractic care, any serious underlying health issues, or anything that would make manual therapy unsafe.
Standard precautions.
Yep. And as we mentioned before, the big one, they had to feel definitely improved by their fourth chiropractic visit. That was key.
So these were people with a track record of recurring low back pain who'd found some real initial relief with chiropractic. What happened after they hit that definitely improved point?
That's exactly when they got randomized.
Oh.
Once that initial treatment phase was done, and the chiropractor felt the patient could likely go a month or more before needing another visit.
Okay.
That's when they were randomly assigned, like flipping a coin, to either the maintenance care group or the symptom-guided treatment group.
And did they collect info before they split them up?
Oh, yeah, absolutely. Before randomization, the researchers gathered a bunch of baseline information, things like how intense their pain was on a standard scale, their overall health rating, psychological stuff like how pain affected their mood and behavior, and how much it limited their daily activities.
Right, so they had a good picture of everyone before the comparison started.
Exactly.
Okay, so we've got our group. They've gotten better. Now they're split into these two different management strategies. Let's talk more about what those strategies actually involve day to day. The MC group first.
Sure. So the maintenance care, or MC group, they had regular checkup appointments scheduled proactively. The chiropractor decided how often these visits should be based on the patient's needs.
So the clinician was in the driving seat for scheduling.
Pretty much. However, and this is important, if someone in that MC group had a new flare-up of pain before their next scheduled appointment, they were told to call in for an earlier visit.
So they didn't have to just wait it out.
No. They'd get treatment then until they were sort of back on track, and then they'd resume their regular preventive schedule.
Okay, that sounds like trying to get ahead of the problem, or at least catch it early. What about the other group, the symptom-guided one?
Right, the symptom-guided treatment group that was the comparison or control group in this study, they had a different set of instructions, basically. Call us if and when your pain comes back.
So the ball was entirely in their court.
Exactly. The control was really in the patient's hands. If they did call because of pain, they would receive treatment until they felt they'd reached their maximum benefit again.
Okay.
And then the instruction was the same. Call again if or when the pain returns.
So a clear difference. Regular planned visits versus waiting for pain to trigger a call. Now, the big question, what did the study actually show? What were the main findings?
Okay, so the primary thing they were looking at, remember, was those days per week with bothersome low back pain tracked over the full year. And the results were what we call statistically significant, which basically means it's unlikely the difference they saw was just due to chance.
And what was the difference?
The maintenance care group reported, on average, 12.8 fewer days with bothersome low back pain compared to the symptom-guided group over that entire 12-month period.
12.8 fewer days. So over a year, that's almost 2 full weeks less of pain that actually gets in your way.
Precisely. It's a noticeable amount when you think about it cumulatively over the year.
Yeah, that definitely sounds like it could make a real difference in someone's life. What about other things they tracked? Any secondary outcomes of interest?
Yeah, there were a few other interesting points. One was that the total number of visits to the chiropractor over the year was actually lower in the symptom-guided treatment group.
Well, that makes sense, right? They were only going when they felt they needed it.
Exactly. It fits the model. The researchers also noticed that, interestingly, both groups continued to improve somewhat even after the study officially started, after randomization.
Oh, so everyone kept getting a bit better.
Yeah, but the maintenance care group improved more quickly. They seemed to reach a more stable point, a steady state with fewer days of bothersome pain each week, and they reached that stable point earlier in the study compared to the other group.
Okay, faster improvement and stabilization with MC.
It's worth noting, though, that the difference between the two groups did seem to narrow a little bit towards the very end of that 12-month period.
Interesting. So maybe the gap shrinks over time.
Potentially. Or maybe the symptom-guided group eventually catches up somewhat. The study gives us that 12-month picture.
Okay, so both groups improving, but MC leads to faster, and for most of the year, greater improvement in bothersome pain days. What kind of treatments were people actually getting in these visits? Was there a big difference in what the chiropractors did between the groups?
That's a good question. According to the study report, the most common treatments used in both groups were actually quite similar.
Oh, really?
Yeah. Things like spinal manipulation, mobilization, which is often a gentler type of movement, and other hands-on techniques were very common in both groups. Slightly more frequent in the MC group, maybe 94% versus 85% of visits, but still high in both.
Okay. What else?
Information and advice were also frequently given out, again, a bit more often in the MC group sessions. And soft tissue therapy, like massage or muscle work, was also used at pretty similar rates in both groups, around 62-63%.
Huh. So it doesn't sound like the type of treatment was drastically different.
No, it seems the main difference really was the timing and the proactive frequency of those treatments in the MC group, rather than some special technique only used in that group.
Okay, so the benefit wasn't necessarily down to some secret sauce treatment, but more about the regular preventative nature of the care strategy itself.
That seems to be the implication, yes.
What about safety? Always important. Were there any risks associated with either approach? Any side effects?
Reassuringly, the study didn't report any serious negative effects or harm in either group, which is good news.
Yeah.
Some people did experience minor things, the kind of transient side effects you sometimes get with manual therapy. A bit of local muscle soreness, maybe some stiffness, occasionally a headache or feeling a bit nauseous.
Right, temporary stuff.
Exactly. And crucially, these minor effects were reported at similar rates in both the maintenance care and the symptom-guided treatment groups. So one approach didn't seem riskier than the other. Both seemed safe.
That's really good to know. Now, every study has its strengths and, areas where it could be improved. What did the researchers themselves point out as the strong points of this particular study?
They highlighted several key strengths, and rightly so. First, the fact that it was a randomized trial is a big plus. That's generally our best way to try and establish a cause and effect relationship rather than just an association.
Right, reduces bias.
Exactly. They also collected a huge amount of data over a long period using those weekly SMS updates, over 16,000 data points, they said. And the response rate was really high, very little missing data, which gives us a detailed, high-quality picture of what people were actually experiencing week to week.
That's impressive.
Yeah. Plus, as we discussed, they specifically chose people with that recurring or persistent back pain who had already shown a good response to initial chiropractic care. This makes the findings arguably more applicable, more relevant to that specific group of patients you might see in a real-world clinic.
Okay, those sound like solid strengths. What about the flip side? The limitations they acknowledged?
They were upfront about a few things. One was that a fairly significant number of people who were initially assessed for this study didn't actually end up being included.
Oh, why not?
It seems it was often because they either got completely better very, very quickly after just 1 or 2 visits, or conversely, they just didn't improve enough by that 4th visit to meet the definitely improved criteria.
So they lost people at both ends of the response spectrum.
Kind of, yeah. Which might limit how broadly we can generalize the findings. They also mentioned the study didn't quite reach the total number of participants they'd originally aimed for based on their initial statistical power calculations.
Does that matter much?
Well, ideally, you want the planned sample size to be confident in your results, but the difference they found was statistically significant anyway. And finally, a key limitation is that the study only followed people for 12 months.
Right.
So we don't really know the effects beyond that year. Would the benefit of MC continue, increase, decrease? We just don't know from this study.
Okay, important things to keep in mind when we're interpreting these results. Now, how does this study fit into the bigger picture? Did its findings line up with other research in this area?
That's always a good question. The researchers did compare their results to another randomized controlled trial by Senna and Shireen. That study also looked at ongoing care after initial success.
Similar findings.
Broadly, yes. The Senna and Shireen study also found that continuing with spinal manipulation after initial improvement led to less pain and disability compared to stopping care.
Okay, so that supports the general idea.
It does. However, the researchers in our main study, the Swedish one, were careful to point out that the specific way the ongoing treatment was delivered in the Senna and Shireen study was a bit different from how maintenance care is typically defined and practiced. The protocol was slightly different.
Details matter.
They do. But overall, yes, both studies seem to point in a similar direction that some form of ongoing or continued care can be beneficial for these types of patients who respond well initially.
So, while the specifics might vary study to study, the general message seems consistent. Okay, let's bring it back to the practical level. What's the real clinical relevance here? The takeaway for people dealing with low back pain and maybe the clinicians treating them.
I think the researchers made a good point emphasizing that they focused on a really relevant outcome for patients that bothersome pain, the pain that actually interferes with daily life. That's often what matters most to people.
True. Not just any pain score, but impact.
Exactly. And while the difference, maybe averaging out to less than 2 days a week difference might not sound huge on its own, when you add it up over a whole year, those nearly 13 fewer days of disruptive pain, well, that's likely to make a real tangible difference in someone's quality of life.
Yeah, I can see that. Less time feeling bothered by your back adds up.
For sure. Plus, the fact that this benefit was achieved without a massive increase in the number of chiropractic visits in the maintenance care group. Remember, the symptom-guided group had fewer visits overall, makes MC look like a potentially pretty efficient way to manage this kind of chronic recurring issue for the right patient.
Fewer days of disruptive pain without a huge burden of extra appointments. That sounds like a potentially good value proposition for some people.
It could be, yeah.
Now, this study focused very much on whether maintenance care works from a clinical outcome perspective. But what about what patients themselves are actually hoping to get out of ongoing chiropractic care? Our sources touch on that too, don't they?
Yes, absolutely. Let's shift gears slightly because our second source gives us some really valuable insights into patient perspectives and expectations. This was a different study by Herman and colleagues published in 2019.
Okay.
And it looks specifically at the treatment goals of people who are already receiving ongoing chiropractic care for chronic spinal pain, both low back pain and neck pain.
So people already in the system getting regular care, what were they hoping to achieve? Were they all looking for that magic bullet and complete pain elimination?
That's one of the really key findings. No, they weren't. The study showed that only a minority of these patients, it was just under a third overall, actually had a primary goal of their pain completely disappearing forever, what the researchers termed a cure.
Really? Only about a third wanted a cure.
Yeah, the majority had goals that were much more about managing their pain in the long run.
Like what kind of goals?
Well, for those with chronic low back pain specifically, about 22% said their main goal was to prevent the pain from coming back. Another 14% wanted to stop it from getting any worse. And about 31% were primarily looking for temporary relief when it flared up.
Interesting. So prevent recurrence, prevent worsening, or get temporary relief. Those were the big ones.
Exactly. The numbers were slightly different for chronic neck pain patients, but the overall trend was the same. Most people in ongoing care weren't necessarily expecting, or perhaps even aiming for, a complete cure.
So for most of these folks, it wasn't about finding that permanent fix, but more about keeping their condition under control day to day, week to week.
That seems to be the picture, yes.
Did the study find any patterns? Like, were certain types of patients more likely to have certain types of goals?
Absolutely. They found some interesting connections. For instance, the people who were hoping for that complete cure tended to have had their pain for a shorter amount of time overall.
Maybe more optimistic early on.
Possibly. And they also tended to have a stronger belief that a medical cure was actually possible for their condition.
Okay. What about the others?
Well, those whose main goal was preventing their pain from returning reported having, on average, lower levels of current pain. Maybe they were in a good phase and wanted to keep it that way.
Makes sense.
And those whose primary goal was either preventing the pain from worsening or just getting temporary relief when needed, they tended to be the ones with a longer history of chronic pain, perhaps more experienced with the ups and downs.
That paints a really fascinating picture. It sounds like people's expectations and what they hope to achieve with ongoing care are really shaped by their personal journey with chronic pain. How long they've had it, how bad it is right now.
Exactly. And this finding, the researchers pointed out, highlights a potential mismatch, or at least something to be aware of.
A mismatch between what?
Between patient goals and maybe how healthcare systems or policies sometimes think about treatment. The second study suggests that a lot of health policy tends to be based implicitly on a curative model, the idea that treatment should lead to a definitive end to the problem.
Right. Fix it and be done.
Yeah.
Yeah.
But for many people with chronic spinal pain who are engaged in ongoing chiropractic care, their actual aims are much more centered around long-term management rather than that complete cure.
Okay, so let's try and bring these two strands together now. We have the first study showing evidence that chiropractic maintenance care can actually reduce the number of bothersome low back pain days for people who respond well initially. And then we have the second study telling us that a lot of people receiving ongoing chiropractic care aren't necessarily seeking a cure anyway, but are more focused on managing their condition long term.
Precisely. It's a really interesting connection.
Cool.
While the first study provides evidence for the effectiveness of MC in lessening the burden of recurring low back pain,
Yeah.
the second study reminds us that what patients themselves are often hoping for with this kind of ongoing care is exactly that. Better management, preventing recurrence, preventing worsening, getting relief, not always chasing a complete elimination of the problem.
So it almost sounds like maintenance care could be a really good fit for the actual expectations and goals that many of these chronic pain patients have.
It certainly seems plausible, doesn't it? The goals seem to align quite well. The treatment strategy potentially helps achieve what the patients are looking for.
Okay, so here's the big wrap-up question then. What does all this mean for you, our listener, and maybe for how we should think about managing low back pain more broadly? We've seen MC can reduce pain days and that many patients are looking for management.
Well, if we connect this back to the bigger picture, I think it strongly suggests that for that specific group, people who've had that initial positive response to chiropractic care, for their recurring or persistent low back pain maintenance care, is definitely something worth considering as part of a long-term strategy.
A viable option on the table.
Yes. It appears to help lessen the actual burden of their condition, reduce those bothersome days, which, as we just discussed, aligns really well with the realistic pain management goals that many of these individuals seem to have.
This really makes you think, doesn't it? Especially given how incredibly common and disruptive chronic low back pain is. How should individuals, clinicians, maybe even policymakers weigh the benefits like fewer bothersome days against the potential costs or effort of these proactive, maintenance-focused approaches compared to just, waiting for the pain to strike again?
It's a crucial question. It really prompts us to consider the value we place on ongoing management versus episodic treatment for chronic conditions, especially where a complete cure might not always be realistic, or even the primary goal for the person actually living with the pain day in, day out.
It definitely gives you something to chew on, perhaps thinking about your own experiences with managing any kind of recurring health issue, not just back pain. What approach feels right for you?
Absolutely. And if you are interested in, digging even deeper into the specifics of the methodology or the detailed data, we absolutely encourage you to check out the original studies we've been discussing today.
Yeah, look them up if you want the full nitty-gritty.
Ultimately, though, just having a better understanding of these different approaches, the proactive versus the reactive, the cure versus management, is so important for improving people's well-being. It helps ensure that the care people receive really lines up with their individual needs and what they're genuinely hoping to achieve.